Schizophrenia is a serious brain disorder. It affects how a person thinks, feels, and behaves. People with schizophrenia may seem like they have lost touch with reality. This can be distressing for them and their loved ones. Schizophrenia is a chronic condition, meaning it lasts for a long time. However, with proper treatment and support, individuals with schizophrenia can live meaningful and fulfilling lives. The exact causes of schizophrenia are still unknown. However, researchers believe that a combination of genetic and environmental factors plays a role. Genetics, meaning it can run in families. Environmental factors such as exposure to viruses or complications during pregnancy or birth may also contribute to the development of schizophrenia. It is important to remember that schizophrenia is not the fault of the individual or their family. It is a medical condition that requires understanding, compassion, and appropriate treatment. Schizophrenia often manifests through a variety of signs, with hallucinations being one of the most prominent. Hallucinations involve experiencing sensory perceptions that are not real. Auditory hallucinations, such as hearing voices, are the most common type. Visual hallucinations, where individuals see things that are not there, can also occur. These experiences can be very frightening and disorienting for individuals with schizophrenia. Delusions are another hallmark sign of schizophrenia. Delusions are firmly held beliefs that are not based on reality. For example, a person with schizophrenia may believe that they are being followed, spied on, or that their thoughts are being controlled by external forces. These delusions can significantly impact a person's thoughts, behaviors, and interactions with others. Thought disorders are also common in schizophrenia. People with thought disorders may have difficulty thinking clearly and logically. Their speech may be disorganized, and they may jump from one topic to another in a way that is difficult to follow. These thought disturbances can make it challenging for individuals with schizophrenia to communicate effectively and engage in everyday conversations. Schizophrenia affects people in different ways. Some people have many severe symptoms, while others have only a few mild ones. Symptoms are generally divided into two categories: positive symptoms and negative symptoms. Positive symptoms are those that are present in people with schizophrenia, but not in people without the disorder. These symptoms include hallucinations, delusions, and thought disorders. Negative symptoms, on the other hand, are behaviors that are typically present in individuals without schizophrenia, but are diminished or absent in those with the disorder. These symptoms include a flat affect, where a person shows little or no emotion, alogia or poverty of speech, avolition, or a lack of motivation and goal-directed behavior, anhedonia, or the inability to experience pleasure, and social withdrawal. It's important to note that not everyone with schizophrenia experiences all of these symptoms. The specific symptoms and their severity can vary widely from person to person. Diagnosing schizophrenia is a comprehensive process that involves multiple steps. There is no single test that can definitively diagnose schizophrenia. Instead, doctors and mental health professionals use a combination of methods to make a diagnosis. One important aspect of diagnosis is a thorough psychiatric evaluation. This evaluation involves gathering information about the individual's medical history, family history of mental illness, and any current symptoms they are experiencing. The doctor will also ask about the individual's thoughts, feelings, and behaviors. In addition to the psychiatric evaluation, doctors may use medical tests to rule out other conditions that could be causing the symptoms. These tests might include blood tests, brain imaging scans, or drug screenings. The goal is to ensure that the symptoms are not due to another medical or psychological disorder. Diagnosis also considers the individual's overall functioning and how their symptoms are impacting their daily life. The diagnostic process aims to gain a comprehensive understanding of the individual's experiences and develop an appropriate treatment plan. Section 5. Treatment and Management. A journey of care and support. Treatment for schizophrenia typically involves a combination of medication and therapy. Antipsychotic medications are the most common type of medication used to treat schizophrenia. These medications work by blocking the effects of dopamine, a neurotransmitter in the brain that is believed to be involved in schizophrenia. Antipsychotic medications can help reduce hallucinations, delusions, and thought disorders. In addition to medication, therapy plays a crucial role in the treatment of schizophrenia. Individual therapy, such as cognitive behavioral therapy or CBT, can help individuals identify and challenge negative thought patterns and develop coping mechanisms for managing their symptoms. Family therapy can also be beneficial in providing support and education to family members, helping them understand and cope with the challenges of schizophrenia. Section 6. Aggravating factors: stress, substance abuse, and environmental triggers. While the exact causes of schizophrenia are not fully understood, several factors can worsen symptoms or increase the risk of relapse. Stress is a significant trigger for many people with schizophrenia. When individuals with schizophrenia experience high levels of stress, it can exacerbate their symptoms and make it more challenging to manage the condition. Substance abuse, including the use of alcohol or drugs, is another factor that can worsen schizophrenia symptoms. Substance abuse can interact with medications, increase the risk of relapse, and negatively impact overall mental health. Environmental triggers such as exposure to violence, trauma, or significant life changes can also contribute to the worsening of schizophrenia symptoms. It's essential for individuals with schizophrenia to be aware of these triggers and develop coping mechanisms to manage them effectively. Section 7. Complications: navigating the challenges of schizophrenia. Schizophrenia can lead to several complications if left untreated or inadequately managed. One potential complication is social isolation. Individuals with schizophrenia may withdraw from social interactions due to their symptoms, leading to feelings of loneliness and isolation. Another complication is difficulty maintaining employment or education. The cognitive and social challenges associated with schizophrenia can make it difficult for individuals to succeed in work or school settings. Substance abuse is another concern for individuals with schizophrenia. Some individuals may turn to drugs or alcohol as a way to cope with their symptoms, which can worsen their condition and lead to addiction. Schizophrenia can also increase the risk of suicidal thoughts and behaviors. It's crucial for individuals with schizophrenia to receive appropriate support and treatment to address these potential complications. Section 8. Preventing complications, early intervention, and ongoing support. Preventing complications and promoting recovery in schizophrenia involves a multifaceted approach that includes early intervention, ongoing support, and a focus on overall well-being. Early intervention is crucial in schizophrenia. When treatment begins as soon as possible after the onset of symptoms, it can significantly improve long-term outcomes. Early intervention allows for timely access to medication, therapy, and support services, which can help manage symptoms, prevent relapse, and improve overall quality of life. Ongoing support is essential for individuals with schizophrenia. This support can come from family and friends, mental health professionals, support groups, or a combination of these resources. Support groups in particular can provide a sense of community and understanding for individuals with schizophrenia and their loved ones. Section 9. Living with schizophrenia, a message of hope and resilience. Living with schizophrenia can be challenging, but it is important to remember that there is hope for a meaningful and fulfilling life. With proper treatment, support, and self-care, individuals with schizophrenia can manage their symptoms, achieve their goals, and live productive lives. It's essential for individuals with schizophrenia to take an active role in their treatment and recovery. This includes taking medications as prescribed, attending therapy sessions, engaging in healthy coping mechanisms, and maintaining open communication with their support system. Remember that schizophrenia is a medical condition, not a personal failing. It's important to challenge stigma, promote understanding, and create a supportive environment for individuals with schizophrenia to thrive.